All right, let's jump right in. Today, we're talking about something super important. See, most of us only think about going to the doctor when we feel sick. But here's the thing. What if some of the most dangerous diseases out there don't actually have any early symptoms at all? Seriously, think about it for a second. If you're feeling great, a checkup probably isn't the first thing on your mind, right? But that's exactly the mindset we need to challenge. Because what you can't feel can absolutely hurt you.
And that's the whole problem right there. These silent conditions can creep up on you for years, causing damage behind the scenes, and you'd never even know it. So today, we're going to dive into 5 essential tests that can catch these issues long before they become a crisis.
Okay, so let's get into this first group of tests. We're calling them the silent killer tests, and for good reason. They screen for conditions that give you absolutely zero warning signs.
First up, the blood pressure test. You know, it's one of the simplest, quickest checks you can get. But there's a huge reason why doctors recommend it for every single adult.
Yeah, the silent killer, that's not just for dramatic effect. The real danger is in what you can't feel. You could be going about your day, feeling totally normal, all while high blood pressure is silently putting a massive strain on your entire body.
And as you can see, the stakes are incredibly high. We're talking about slow, quiet damage to your most vital organs, your heart, your brain, your kidneys. So catching it early isn't just about avoiding a bad diagnosis. It's about actively adding more healthy, high-quality years to your life.
Okay, let's move on to test number 2, the blood sugar test. This one is so critical for catching pre-diabetes. Think of it as a warning sign. Your blood sugar is higher than it should be, but it's not quite at the level of type 2 diabetes yet. It gives you this crucial window to turn things around.
And a lot like high blood pressure, high blood sugar quietly attacks the body. Over time, it can lead to some really serious stuff, nerve damage, kidney failure, and it massively increases your risk of heart disease. The damage is slow, but believe me, it's serious. A simple blood sugar test is your early warning system.
And our third silent test is for cholesterol, sometimes called a lipid panel. This one is so important for all adults. Even if you're active, you eat well, and you feel perfectly healthy. Because you just cannot feel high cholesterol. There's no pain, no dizziness, no sign whatsoever. What's actually happening on the inside is that fatty deposits, or plaque, are slowly building up, hardening your arteries and making them narrower.
So here's the bottom line. That slow, silent buildup dramatically raises your risk for 2 of the most serious medical events possible, a heart attack or a stroke. Knowing your cholesterol numbers isn't about looking for a problem. It's about giving yourself the power to prevent one. Okay, moving on. Our next test is a little different. It doesn't just hunt for one specific condition. It's more like a detective, you know? It's looking for hidden clues to explain some of those things you might just be brushing off.
I think we all have, right? It's so easy to just blame being tired on a busy week or not getting enough sleep. But what if that nagging fatigue is actually your body trying to tell you something more? And this brings us to the complete blood count, or CBC. It's one of the most common blood tests for a reason. It gives this amazing, broad overview of your general health by looking at the 3 main types of cells in your blood: your red cells, white cells, and platelets.
So that feeling of being constantly drained? It could be anemia, which just means you don't have enough healthy red blood cells carrying oxygen around your body. Or maybe it points to a low-grade infection your body's fighting, or even an issue with your immune system. A CBC can be the key that finally unlocks that mystery.
And now for our final category. These are the screenings that doctors say are absolutely crucial for your long-term survival, yet they're the ones people are most likely to avoid or put off. We're talking about age and risk-based cancer screenings. Now, the specific tests are different for everyone, things like colonoscopies, mammograms, pap smears, but they all share one critical goal: to find trouble before you ever feel a single symptom. For instance, a colon screening can find and remove tiny growths called polyps years before they'd ever have a chance to become cancer. It's literally stopping cancer before it starts. And this is the bottom line. This is the single most important message when it comes to cancer. Catching it early when it's small and hasn't spread means treatments are often less invasive, much more effective, and survival rates just skyrocket. It is the single biggest advantage you can give yourself.
So after hearing all that, I know it might feel a little intimidating, but let's reframe this. This isn't about being scared. It's about being smart and taking control of your own health. Look at this comparison. You can live with a fear-based mindset, just waiting for symptoms to show up and then reacting to a crisis. Or You can adopt a prevention mindset. You can be proactive, get regular checkups, catch things early, and actually invest in your future health. This quote really says it all. These tests, they're not about looking for something to be afraid of. They are your best tools for prevention. They empower you with information to make sure you have a long, healthy future ahead of you.
So, I'll just leave you with this question to think about. Based on everything we've covered, what's one simple, proactive step you can take? Which of these tests might be right for you to schedule, not because you feel sick, but because you want to stay healthy?